Good evening, students. Good evening, students. I hope I am audible. So, in today's class, we'll discuss about the chronology of dentition, right? Chronology of dentition. So, what is chronology? Basically, chronology deals with the timeline of the development, like eruption of tooth, development, eruption, root completion, so all those things. And in case of deciduous, exfoliation, right? So in case of deciduous, we even talk about exfoliation. So development, eruption, root completion, exfoliation, all these things are included under chronology. So before we go to these details about these dates, let's just have a brief view of the different stages of the development of a tooth, right? So during tooth development, basically the tooth shows three morphologically distinct stages: bud, cap, and bell, right? So before the bud stage, there is the dental lamina. So this dental lamina would proliferate to form the bud stage, and later on when the bell stage arrives, so in the bell stage, let's say this is the bell stage, right? This is the bell stage. So in the bell stage, apposition, that is formation of hard tissue. Formation of hard tissue will take place. Right? So formation of hard tissue will take place in the late bell stage. Formation of hard tissue occurs in the late bell. Right? So these are the three distinct stages morphologically. Right? Morphologically, three distinct stages in which we can study the tooth development. But we will go to these in detail when we are studying them in the oral histology. Right now, we will discuss about the chronology, that is timing. So before we go to the chronology per se, that is the ages or the timing of the development of primary and permanent tooth, let me tell you some other important dates before the mineralization of these teeth begins, right? So let's say the first molecular marker of tooth development is seen at what time? So the first molecular marker of tooth development is seen at approximately 9 days of intrauterine life, right? So the first gene is expressed at the 9 days. It is LEF, right? What gene are we talking about? LEF. The first histological marker of tooth development, or you can say first histological evidence of tooth development, it appears at 11th day of intrauterine life, and basically we are talking about the initiation of primary epithelial band, right? So the primary epithelial band formation starts at the 11th day of intrauterine life. Next, first evidence of tooth formation. So first evidence of tooth formation is seen at 6th week or 6 weeks of intrauterine life. So what does this imply? It implies that the dental lamina is established. Right, dental lamina is established at the 6th week. Next, first morphological evidence of tooth formation. So the first morphological evidence of tooth formation is seen at 11 weeks of intrauterine life. And what happens here? The teeth buds of lower central incisors, right, lower AA, are large enough to be seen without a, right, that is without any aid, without any microscope, you can visualize these tooth buds. Clear? So first radiographic evidence of tooth formation. So again, this first radiographic evidence of tooth formation is seen when the lower central incisors, primary central incisors are, or they have started to calcify. So now they can be seen on the radiograph, right? So this is seen at the 14th week of intrauterine life, right? So these are some different dates that you need to remember. They are important, and sometimes questions may be asked on these dates, right? So let's now go to the chronology of the primary teeth. Let's begin with the chronology of primary dentition. Right, chronology of primary dentition. I hope it is clear, right? I hope the concept is clear. Do you have any doubt? If you have any doubt so far, please ask me, right? So let's go to the chronology of primary dentition, and in the chronology we will discuss it under 4 headings, right? First is initiation, that is initiation of mineralization, then crown completion, then eruption, and finally root completion, right? So let's begin with the primary dentition. So in the primary dentition, we'll write here the maxillary arch. So for the maxillary arch, we'll just say A, B, C, D and E, and below it we'll write the mandibular teeth, right? So mandibular teeth A, B, C, D and E, right? So as we have just discussed, when I was telling you about those important dates, I told you that the first evidence of radiographic evidence of tooth development is seen at 14th week of intrauterine life, isn't it? So when we are talking about initiation again implies initiation of mineralization of the crown, right? So it would begin at 14th week of intrauterine life. So the first tooth to initiate would initiate at 14th week of intrauterine life. So which would be the first tooth to initiate? It would be central incisor, isn't it? It would be central incisors. So the central incisors will initiate at first week of intrauterine life, both the upper and lower central incisors, isn't it? Upper and lower central incisors. So both upper and lower central incisors will initiate at the 14th week of intrauterine life. Now, to remember, how do we remember these dates? Isn't it? How do we remember these dates? Because there are 10 teeth, so there will be 10 dates. So how do we remember these 10 dates? Just remember that these initiate every next week, right? So 14, 15, 16, 17, 18 and 19. You just need to remember these 6 dates, 14 to 19. So on the 14th week, the central incisors, both upper and lower, will initiate. Next, 15th week, the first molars will initiate, right? So our anterior tooth has initiated, now our posterior tooth will initiate, right? So which tooth will initiate first, the maxillary or the mandibular? Usually what happens is the mandibular teeth, they lead, isn't it? They will be the first to initiate, first to erupt, isn't it? But in case of initiation of first primary molar, the maxillary molars will first initiate. So maxillary first molars will initiate at 15th week, whereas the lower first molars will initiate at 15 and a half week, right? So they will initiate a few days after the upper first molars. Next, upper and lower central incisors. So after 15, it would be 16 weeks, right? 16 weeks. So upper and lower lateral incisors will initiate at 16 weeks. Next, which tooth will initiate at 17 weeks? It would be canine, right? So both the canines will initiate at 17 weeks. Now we know that the mandibular first molar, it initiated after the maxillary first molar, but the mandibular second molar will initiate before the maxillary second molar, isn't it? So here the second molar initiates at 18 weeks, whereas the maxillary second molar initiates at 19 weeks, right? So that's how we can remember these dates. Just remember the numbers 14 to 19. 14 for central incisor, 15 for first molar, 16 for canines, lateral incisor, 17 for canine, 18 for lower second molar and 19 for upper second molar, right? I hope it's not too confusing. These dates sometimes are confusing, isn't it? I hope it's not too confusing. So when we talk about crown completion, obviously the crown completion would be after birth, right? The crown completion takes place after birth, isn't it? So these dates will be in months. So the first tooth to complete would be at 1.5 months after birth, right? So after that, at 2.5 months, the next tooth will complete. Then at 3 months, then at 6, then 9, 10 and 11. So you can remember the dates like 1.5, 2.5, 3, 6, 9, 10 and 11. So these are the dates for crown completion. So which tooth will be the first to complete? Right, which tooth will be the first to complete? So if we are talking about dates, just remember 1.5, 2.5, 3, 6, 9, 10, 11 and 12. So these are the dates for the crown completion of the primary dentition. So which tooth is the first to complete? Obviously the one that initiated first, that would complete first. Now you must be wondering whether it would be lower central incisor or upper central incisors or both. So the answer here is it is the upper central incisor that completes before lower central incisor, right? The upper central incisor will complete at 1.5 months, right? Upper central incisor, lower central incisor and upper lateral incisor, they both will complete, or their crowns will complete at 2.5 months, right? They'll complete at 2.5 months. Next is lower lateral incisor. It would complete at 3 months. So that only 1, 2, 3. Now next is which tooth will complete at 6 months and which will complete at 9 months. So the tooth that completes at 6 months is the posterior tooth that initiated after central incisor. So the first molar initiated after central incisor, isn't it? So it will complete after lateral incisor. Now remember that while initiation, the lower first molar initiated after upper first molar, but during completion, crown completion, the lower first molar will complete before the upper first molar. So the crown of the lower first molar will complete at 5.5 months, whereas that of upper first molar will complete at 6 months, right? So lower first molar crown completes half a month before upper first molar. The next date is 9 months. So at 9 months, both the canines will complete. So now we have the second molar. Just like the initiation, the mandibular second molar crown will complete before the maxillary second molar. So mandibular second molar completes at 10 months, whereas the maxillary second molar completes at 11 months, right? So let's revise it once again. As I told you, the dates are 1.5, 2.5, 3, then 6, then 9, 10 and 11. So at 1.5 months, the upper central incisor completes. At 2.5 months, lower central, upper lateral completes. At 3 months, lower lateral completes. At 6, upper and lower first molars will complete. The lower first molar half a month before the upper first molar, isn't it? So lower molar completes at 5.5 months. At 9 months, the canines will complete. At 10, lower E, and at 11, upper E, right? So here you can see the upper D initiates before lower D, but lower D crown completes before the upper D, isn't it? So let's now go to the eruption. So initially what we used to say that the first primary tooth would erupt at an age of about 6 months, but recently what we see is that the first deciduous tooth erupts at an age of about 8 months, not 6 months, right? So the first tooth to erupt would be lower central incisor. So the lower central incisors erupt at a date of about, or erupt at an age of about 8 months, right? They erupt at an age of about 8 months. So which tooth will erupt next? After the lower centrals, it is the upper central and then upper lateral, right? So upper central and then upper lateral. So upper central erupts at 10 months, then upper lateral will erupt at 11 months, right? So the sequence is lower central, then upper central, upper lateral, then lower lateral. So lower laterals will erupt at 13 months, isn't it? So incisors 8, then 10, then 11 and then 13. So lower central, upper lateral and then lower lateral. After that, the first molars will erupt, isn't it? After that, the first molars will erupt before the canine. So both the first molars will erupt at about 16 months. Right, they both will erupt at about 16 months. So which tooth will erupt next? It will be the canine. So when does the canine erupt? The upper canine erupts slightly before lower canine. In case of permanents, the lower canine erupts before, or the lower canine erupts ahead of upper canine. But in case of primary, the maxillary canine erupts ahead of primary canine, right? So the maxillary canine erupts at a date of 19 months, whereas mandibular canine erupts at a date of 20 months, right? Now the second molars. So second molars, the mandibular molar erupts ahead of maxillary molar. So the last tooth to erupt would be maxillary second molar, and the first tooth to erupt would be mandibular central incisor, isn't it? So what did we notice here? We noticed that lower D initiates after upper D, but lower D crown completes ahead of upper D, isn't it? Also, what did we notice? We noticed that in permanent dentition, mandibular canine erupts ahead of maxillary canine but in primary dentition. Mandibular canine erupts after maxillary canine. So these are few of the things that we have noted here, isn't it? That lower D initiates after upper D, but the lower D crown completes ahead of upper D. Also in secondary dentition or in permanent dentition, mandibular canine erupts ahead of maxillary canine, but in case of primary dentition, it is the maxillary canine which erupts ahead of mandibular canine, right? So these are some of the variations that may be asked, isn't it? So the first deciduous tooth to erupt is at 8 months is the lower sentinel incisor, and the last tooth to erupt is the maxillary second molar, right? So these things we may remember. Now as far as the root completion is concerned, in case of primaries, it is approximately 1 to 1.5 years after eruption, isn't it? Root completion is approximately 1 to 1.5 years after eruption, isn't it? It is 1 to 1.5 years after eruption. So the root completes one to 1.5 years after eruption in primary teeth, right? 1 to 1.5 years after completion. So when would the root of lower central incisor would complete? So the lower central incisor, the upper central incisor, they both will complete at an age of about 1.5 years. Right? They both will complete at an age of about 1.5 years. 1.5 years. Next, which tooth will complete? The lower lateral incisor, it will also complete somewhere around 1.5 years. Then upper lateral around 2 years, right? Next, which tooth will complete? It would be the lower and upper first molars. They will complete 6 months after the upper lateral. So as you can notice, there is a difference of 6 months between the lower incisors, upper central and the upper lateral. So lower incisors, upper incisors, they complete at 1.5 years. Upper lateral at 2 years, that is 6 months after those teeth. Then 6 months after this, the first molars, right, both the upper and lower first molars will complete 6 months after this. Again add 6 months to it and you will get the root completion date for second molars. Again add 6 months and you get the root completion date for canines. So the root of the canine is the last to complete, isn't it? The root of the canine is the last to complete. So what is the another observation? Canine's root are last to complete, isn't it? The roots of the canines are last to complete. Is it clear? Do you have any doubts? So as you can see, the incisors, their roots complete at about 1.5 years. Add 6 months to it, 2 years. Upper lateral, again add 6 months, 2.5 years. Upper and lower first molars, again add 6 months, 3 years. Upper and lower second molars, again add 6 months, 3.5 years. That is canines. So canines are the last to complete, isn't it? Canines are the last to complete. So how many years after root completion does it start to resolve? How many years after root completion does the root start to resolve? So root resorption begins about 3 years after root completion. So say for example, in case of incisors, their root completes at about 1.5 to 2 years, isn't it? If we consider both the upper and lower central and lateral incisors, their roots complete at about 1.5 to 2 years. So their resorption will begin at about or approximately around 5 years, isn't it? In case of canines, canine root completion, canines root complete about 3.5 years. So their resorption will begin about 6.5 to 7 years, isn't it? So it depends on the time of root completion. So based on the time of root completion, their resorption would begin. But if someone asks you when does the root completion start, when does the or what is at what age does the root completion root resorption start? So can we say that the root resorption for any root will start not before 5 years of age, right? Not before 5 years of age, approximately 5 years of age, isn't it? So approximately 5 years of age, this is the age when the root resorption starts. The first root to resorb would be that of incisors, isn't it? The first root to resorb would be that of incisors. The first root to resorb would be that of incisors. Is it clear? Do you have any doubts? Since no one is posting anything, I'll assume that you don't have any doubts. So either it is perfectly clear or the lecture is clean and clear. या तो सब समझ में आ रहा है या कुछ भी समझ नहीं आ रहा, right? I hope it's not clean and clear, but clear. कुछ समझ में आ रहा है. And yes, this is a boring part of the subject. अगर हम dental anatomy की बात करें तो chronology is one of the boring topics, but still it is an important part, right? क्यों इम्पोर्टेंट है? ये हम chronology जब पढ़ लेंगे उसके बाद इसका एप्लीकेशन जब आएगा तब हमें समझ में आएगा. सो एप्लीकेशन कहाँ आ सकता है? इन केस ऑफ ओरल पैथोलॉजी, maybe they'll ask you chronological hypoplasia. What is chronological hypoplasia? Let's say a patient falls ill while he was a child, right, or while she was a child, and you notice a hypoplastic defect or a hypoplastic line on their teeth. So the question might be, what was the age of the child when they fell ill, or what was the age of the child when they consumed a certain drug or fluoride exposure? So all those things you can calculate with the help of chronology. Whether a patient is suffering from hypodontia or whether the tooth is delayed, all those things can be you can understand better when you remember these dates, right? So it helps in age estimation, it helps in identifying whether a patient is suffering from hypodontia, it helps in identifying the timing of the defect. So that is how, or that those are the clinical applications of chronology, right? So let's now go to the chronology of permanent dentition. So the chronology of permanent dentition, just like primary, we'll discuss it under 4 headings: initiation, crown completion, eruption, and root completion. Right, same as deciduous dentition. So initiation, crown completion, eruption, and root completion. Now all these dates would be in years, except for some which we'll see. So let's say these are the maxillary teeth: 1, 2, 3, 4, 5, 6, 7, and 8. Similarly, for mandibular, 1, 2, 3, 4, 5, 6, 7, and 8. So all the teeth are here, right? So let's talk about initiation. So when we talk about initiation, remember that some of the teeth will initiate in the first year of life, then some will initiate in the second year of life, others will initiate in third year of life, right? Except for the third molar. So these rules are for all the teeth except third molars. So some teeth will initiate in first year of life. How many? 4. So in the first year of life, 4 teeth will initiate. So when we are talking about initiation, in first year of life, 4 teeth initiate, right? In second year, 1 tooth initiates, and in third year, 2 teeth initiate, right? So except for third molars, all the other teeth, they will initiate in the first 3 years of life. 4 in the first year, 1 in the second year, and 2 in the third year. So which teeth will initiate in the first year of life? All the anteriors and first molar. So all anteriors and first molars will initiate in the first year of life. So when you have written here that 4 teeth initiate, what will you additionally write? All anteriors and first molars, right? So when do the incisors and canines and the first molars initiate? So the first tooth to initiate is the first molar, and it initiates at birth, right? Or you can simply say 0, right? So at the time of birth, this tooth initiates. So at the time of birth, this tooth will initiate. Next, which tooth will initiate? Next, the incisors will initiate. So incisors initiate at 3 to 4 months, right? Upper central, lower central, and lower lateral, they initiate at an age of 3 to 4 months, isn't it? They initiate at an age of 3 to 4 months. And don't say intrauterine life, they all initiate after birth, right? So 3 to 4 months after birth. Which is the next tooth to initiate? The next tooth would be canine at 4 to 5 months, upper and lower canine. Now you would notice that I haven't written anything after this upper lateral incisor, because the upper lateral incisor is the last anterior tooth to initiate, and this tooth will initiate at 10 to 12 months, that is at the end of first year. So upper lateral incisor is the last anterior tooth to initiate, isn't it? Upper lateral is the last anterior tooth to initiate. So last anterior tooth to initiate is the upper lateral at 10 to 12 months. So this question may be asked, which is the last anterior tooth to initiate, right? So based on whatever we have studied so far, if I ask you how many teeth will be seen on a radiograph, that is, let's say OPG, of a newborn child. So if we take an OPG of a newborn child, how many teeth will be visible? Let's say option A is 20, option B is 16, option C is 24, option D is 22, right? So how many teeth do you think will be visible on the radiograph of a newly born child, right? Of a newborn child, how many teeth will be seen? Now, as we have studied in the deciduous dentition, that all primary initiate in the intrauterine life, so they all undergo calcification, isn't it? So they will be visible on the radiograph. What about the first permanent molars? Since they start to calcify at the time of birth, they will also be visible on the radiograph. So how many first molars are there? 4 and 20 primary teeth. So in total, how many teeth will be visible on the radiograph of a newborn child? Approximately 24. So all the primary and the 4 first permanent molars, right? So these are the teeth that will be visible on the radiograph of a newborn child. Let's now go to the teeth that initiate in the second year of life. So which tooth do you think will initiate in the second year of life? As I just told you that there is only one tooth that initiates in the second year of life, isn't it? So which is this tooth that initiates in the second year of life? This is the first premolar. So first premolar, it initiates at about 1.5 to 2 years. The upper first molar initiates at about 1.5 to 2 years, and the lower first molar, the upper first molar initiates at about 1.5 to 2 years, and the lower first molar initiates at about 1.25 to 2 years. So basically, there is a difference of just 3 months in the initiation date of the upper and lower first premolars. You may say that the lower first premolar initiates ahead of upper first premolar. So in general, we can say that the mandibular teeth will initiate ahead of their maxillary counterparts. Right? Mandibular teeth will initiate ahead of their maxillary counterparts. Right? You would have noticed same in case of lateral incisor as well. Maxillolateral incisor is the one that is delayed, isn't it? So in the second year, only one tooth is initiated, that is first premolar. First premolar, isn't it? And so what are the two teeth we are left with? Second premolar and second molar. So these two teeth will be initiated in the third year of life. So in the first half, that is 2.5 years, second premolars will be initiated, and in the second half, that is 2.5 to 3 years, second molars will be initiated, isn't it? So both for maxillary and mandibular, 2 to 2.5 years for the premolar and 2.5 to 3 years for the molar. Right? So in the third year, two teeth will initiate, the second premolar and the second molar. Right? And as a general rule, as I just told you, mandibular teeth will initiate ahead of their maxillary counterparts. So when do the third molars initiate? The third molars will initiate at an age of about 7 to 10 years. Right? They will initiate at an age of about 7 to 10 years. So maxillary third molars, they will initiate at an age of 7 to 9 years, whereas the mandibular third molars will initiate at an age of 8 to 10 years. So except for third molars, all mandibular teeth initiate ahead of maxillary teeth, right? So what we can say here is that except third molars, all mandibular teeth initiate ahead of maxillary teeth, right? So for third molars, remember the date, 7 to 10 years. 7 to 9 years is for maxillary and 8 to 10 is for mandibular, isn't it? 8 to 10 years is for mandibular and 7 to 9 is for maxillary. So maxillary third molar is ahead of mandibular third molars. So this was for the initiation. Now when we go to the crown completion, so just like initiation 1, 2, 3, in the first 3 years the teeth initiated, in the next years, that is from 3, 4, 5, 6, like this, the teeth will complete or the crown will complete. So the first tooth to complete would be the first tooth that initiated, right? And it will complete at the time the second molars initiated. So when the second molars initiated, the first molars completed, right? So the first tooth to complete is the maxillary and mandibular first molar, and they will complete in the third year of life when the second molars were initiated, isn't it? So I hope it's easy to remember. When the second molar initiates, the first molar completes. So by 3 years of life, we have all the teeth initiated except for third molars, and the maxillary and mandibular first molar crown is completed. So that is all happening in the first 3 years of life. Next 4 to 5 years, which next tooth will complete? So during 4 to 5 years, all the incisors will complete, isn't it? all the incisors will complete in 4 to 5 years. So 4 to 5 years, all the incisors will complete. So as you would have noticed, though the maxillary lateral incisor initiated at the end of first year, it completes almost along with all the other incisors. So all the incisors, they complete at 4 to 5 years of age. Next, 5 to 6 years. So which two do you think would complete at 5 to 6 years? Would it be canine or the first premolar? Would it be canine or the first premolar? Now remember that the canine has the longest tooth, isn't it? It is the largest anterior tooth, or you can say it is the largest single-rooted tooth. Isn't it? Canine is the largest single-rooted tooth. Canine is the largest single-rooted tooth. So that means it is larger than the first premolar, isn't it? It is also larger than the first premolar. So which two do you think would complete first? Is it the canine or is it the first premolar? So the answer is first premolar, isn't it? So the first premolars, they complete at 5 to 7 years of age, both maxillary and mandibular, right? First premolars, they complete at 5 to 7 years of age. Sorry, 5 to 6 years of age. Five to 6 years of age. So after that, the third molars will, the canines will complete at 6 to 7 years of age, and along with the canine, the second premolars will also complete at 6 to 7 years of age, right? So first molars are the first to complete, first to show ground completion. After first molars, all the incisors. After the incisors, first premolars. After first premolars, canine and second premolars, right? So that is the sequence of ground completion. First molar, incisor, first premolar, canine and second premolar. And after that, obviously, it is the second molar. So second molars will complete at an age of about 7 to 8 years. So when the third molars were initiating, the second molar completed, right? So the second molars will complete at an age of 7 to 8 years. Will complete at an age of 7 to 8 years. So as you can see, roughly, when the third molar was initiating, the second molars completed. When the second molar was initiating, the first molars completed, isn't it? So I hope it is easier to remember this. So in the first 3 years of life, all the teeth will initiate. Then after that, in the 4th to 5th year of life, all the incisors are completed. 5 to 6 years of life, first premolars 6 to 7, canine and second premolars 7 to 8, second molars. So when do the third molars complete? They'll complete around 12 to 16 years of life, right? They'll complete around 12 to 16 years of life. Now the maxillary third molars, they initiated before mandibular third molars, isn't it? But they'll complete after mandibular third molars. The variation might be small, but it is there, right? So the third molars, so maxillary third molars initiated ahead of mandibular third molar, but maxillary third molar crown completes after mandibular third molar crown, right? So it initiates before mandibular third molar, but its crown completes after mandibular third molar. So these were the eruption dates and these were the initiation and crown completion dates. So let's go back to it once again. The first tooth to complete, or the crown completion for the first tooth is first molar. After that, all the incisor crowns are completed 4 to 5 years of age, right? All the incisors are completed at 4 to 5 years of age. Then first premolar at 5 to 6 years of age, right? First premolar at 5 to 6 years of age. Then canine and second premolars at 6 to 7 years of age. And lastly, second molars at 7 to 8 years of age. Then third molars 12 to 16 years. But maxillary third molar is a little bit delayed, isn't it? It completes after mandibular third molar. So next, let's go to the eruption dates, isn't it? So which is the first tooth to erupt? The one that initiates first will erupt first, isn't it? So which is the first tooth to erupt? The first tooth to erupt would be maxillary and mandibular third molars, and they'll erupt at an age of about 6 years, isn't it? They erupt at an age of about 6 years. They erupt at an age of about 6 years, isn't it? Which is the next tooth to erupt? It is the mandibular central incisor. So it erupts almost along with the first molars at 6 to 7 years of age. So lower and upper first molars and lower central incisor, they all erupt at an age of about 6 to 7 years. Next, mandibular lateral and maxillary central. So mandibular lateral and maxillary central, they both erupt at an age of about 7 to 8 years. So as you would notice, mandibular central incisor erupted ahead of maxillary central. Mandibular lateral again erupted ahead of maxillary lateral, because maxillary lateral would erupt somewhere around 8 to 9 years, isn't it? So can we say that mandibular teeth will erupt ahead of maxillary teeth, isn't it? Mandibular teeth will erupt ahead of maxillary teeth, isn't it? So which is the next tooth to erupt after the incisors? The next tooth to erupt would be the mandibular canine, isn't it? So when the incisors have erupted, can we say that this is the early mixed dentition phase, isn't it? And the late mixed dentition phase starts from the 9 years onwards, when the canine and deciduous molars are replaced by permanent canine and the premolars, isn't it? So in the late mixed dentition phase, which starts at 9 years, the canines and the primary molars are replaced by the canines, permanent canines and the premolars, isn't it? So which is the first tooth to erupt in the late mixed dentition phase? It is the mandibular canine, and it erupts at an age of about 9 to 10 years, isn't it? So now you might imagine that the next tooth to erupt would be maxillary canine, but that does not happen. The next tooth that will erupt is maxillary first premolar, isn't it? And here things change. See, right now what we saw is that the mandibular teeth erupt ahead of their maxillary counterparts, but the premolars, they are different. The maxillary premolars erupt ahead of mandibular premolars. So here the sequence changes a little bit, right? So which is the next tooth to erupt? It is the first premolar but maxillary, right? So the maxillary first premolar erupts at an age of 10 to 11 years, isn't it? They will erupt at an age of 10 to 11 years. Now remember that upper and lower premolars and the upper canine, they will erupt in the duration of 10 to 12 years, right? So what we can remember here is that upper and lower premolar and upper canine, they will erupt between 10 to 12 years. So just to ease the dates, the earlier teeth, the teeth that erupt earlier, will erupt at about 10 to 11 years. Then the next teeth, the teeth that erupt in the middle, you can say they erupt at about 10 to 12 years. This is what we are going to write, right? 10 to 12 years. And the teeth that are coming last will erupt at about 11 to 12 years. So this is the range, right? So that don't get confused with this 10 to 12 years. Don't say that these might erupt ahead of the teeth that are erupting at 10 to 11 years. That won't happen, right? So just to have an idea of range, remember that the teeth that erupt early, will say that they erupt at 10 to 11, then after those into 12, and the last teeth to erupt will erupt at 11 to 12 years, right? So which tooth erupted at 10 to 11 years? It is the maxillary first premolar. After that, mandibular first premolar and maxillary second premolar, they are going to erupt. So at what time do you think they will erupt? So mandibular first premolar at 10 to 12 years. Same for maxillary second premolar, 10 to 12 years, isn't it? 10 to 12 years. So which tooth? So which tooth erupts next? Yeah, sorry. 10 to 12 for mandibular first and 10 to 12 for maxillary second. They both will erupt at the same time. So which is the last tooth remaining in the late presentation phase? Lower second premolar and the upper canine. So these both will erupt at 11 to 12 years. Right, these both will erupt at 11 to 12 years. So 9 to 10, lower canine. Then next tooth to erupt is the upper first premolar, isn't it? Upper first premolar at the age of 10 to 11 years, isn't it? After that, lower first premolar 10 to 12 along with the upper second premolar 10 to 12 years. Then lower second premolar and upper canine, right? So what have we seen so far? What have we seen so far? After mandibular central incisor, maxillary central incisor erupts. After mandibular lateral incisor, maxillary lateral incisor erupts, isn't it? After canine, mandibular canine, maxillary canine erupts. But after maxillary premolar, mandibular premolar erupts. And after maxillary second premolar, mandibular second premolar erupts. So as you can see, the sequence of eruption changes in the premolar segment, isn't it? The sequence of eruption changes in the premolar segment. Rest everywhere, the mandibular teeth are erupting ahead of their maxillary counterparts, right? So let's go to the next teeth. So far, what has happened? All the interiors have erupted, all the premolars have erupted, and the first molars have erupted. So what are we left with? We are left with the second molars. And do you know that the second molars are also known as the 13-year molars? Why? Because they erupt at an age of around 13 years, isn't it? They erupt at an age of around 13 years. So when I say around 13 years, they are likely to erupt around 12 to 13 years, isn't it? 12 to 13 years. And when do the third molars erupt? They are often called the wisdom tooth, isn't it? And since they are called the wisdom tooth, they erupt around 18 years of age. So if we take a rough age, it erupts at an age of around 17 to 21 years, right? They erupt at an age of around 17 to 21 years. So again, the same sequence will continue, the same pattern will continue. Lower 6 ahead of upper 6, lower 7 ahead of upper 7, and lower 8 ahead of upper 8, right? Except for the premolars, all the mandibular teeth will erupt ahead of maxillary teeth. Clear? If you have any doubt, please ask me. अगर आपको कोई भी डाउट है तो मुझसे पूछ सकते हो. अगर कोई भी डाउट है तो आप लोग मुझसे पूछ सकते हो, राइट? अगर कोई भी डाउट है तो आप लोग पूछ सकते हो. So let's go to the root completion. Now in case of root completion, it's not the first molar which will complete its root ahead of everyone else, right? Since the lower central incisor is the smallest root, its roots will complete ahead of all the other permanent teeth. So lower central incisor, the roots will complete at an age of about 9 years, and the first molars, they will show root completion at an age of about 9 to 10 years. So almost simultaneously, right? Almost simultaneously. Now we know that the roots of permanent teeth, they complete about 2.5 to 3 years after eruption, isn't it? So the roots of permanent dentition completes 2.5 to 3 years after eruption, isn't it? 2.5 to 3 years after eruption. So we just add these many years to their eruption dates, and that's how you can get their root completion dates, isn't it? So 9 to 10 years is for the first molar. So the next two to complete would be lower lateral, and along with the lower lateral, upper central roots will also complete. So upper central also completes about 10 years of age. Then next is 11 years. So all the incisors are completed and the first molars are completed, right? Roots of all the incisors and first molars are completed. So which root will complete next? As I have just told you, the premolar are smaller than the canines. So definitely the premolar root will complete ahead of the canine root, isn't it? So both for maxillary and mandibular, the first premolar root completes at the same time the maxillary and mandibular second molars erupt, right? About 12 to 13 years of age. So when the second molars are erupting, first premolars root are completing. So their roots complete at 12 to 13 years of age, both for upper and lower first premolar, right? Next, whose root will complete? Canine at about 13 to 14 years, right? 13 to 14 years. Next, second premolar. So second premolars will also complete at about the same age. They will also complete at about the same age. You can say 12 to 14 years. Same year, 12 to 14 years. Next would be second molars. So second molars will complete at 14 to 16 years. Same for mandibular. And the last to complete would be third molars at about 18 to 24 years. But always remember that the mandibular teeth, they will show completion ahead of the maxillary teeth, isn't it? Their roots will complete ahead of the maxillary counterparts. So what have we noticed here? So the main thing, or the main change in the sequence is here. In the eruption of premolars, right? Except for premolars, all other teeth, mandibular teeth will erupt ahead of maxillary teeth, except for premolars. So this is the sequence, this is the change in the sequence that we need to remember, isn't it? So apart from this, how can we calculate the age, or what is this used for? Maybe this is used for age estimation in forensics, isn't it? So based on eruption date, you can calculate the age, isn't it? Based on eruption dates, you can calculate the age. So that is also known as the dental age. That is also known as the dental age. So let's say if a person has second molars, right? If a person has second molars, if the second molars are erupted in the oral cavity, then we can safely say that this person is at least 13 years of age, isn't it? And if these second molars have complete roots, right? If the second molars have complete root, if their roots are complete, then we can say that this person is at least 14 to 16 years old, isn't it? We can say that this person is 14 to 16 years old, and we can safely say that maybe this person is around 18 to 16 years old. If the third molars are present in the oral cavity, we can safely say that this person is around 18 years of age. isn't it? So that's how we can calculate the dental age based on the eruption pattern, based on the X-ray, right? We can take the IOPA to check the root completion. So if the root is completed, we can assume the age, right? What else can it help with in estimating the timing of chronological defect, chronological hypoplasia or hypocalcification? So let's say you are given this diagram. Let's say you are given this diagram where the different teeth are shown, isn't it? Where the different teeth are shown, and you have said that this person at some time of his life was exposed to a certain drug, or maybe this person fell ill, and let's say that there is this defect running across his teeth, isn't it? Let's say there is this defect running across his teeth. So you are asked the timing of this defect, when this, what was the age of this person when this defect formed, right? So when this hypoplastic defect occurred. Now since this is a line defect, we can safely assume that this is a chronological hypoplasia, right? Chronological hypoplasia at the same time, at a particular time, at a moment in his life, or at a moment in our life, this person was exposed to a certain drug, or maybe to fluoride, or maybe to some other illness, because of which there was a lack in development, because of which this hypoplastic defect is seen, right? So how do we calculate the age? So the safest tooth to do this is this maxillary central incisor, isn't it? The central incisor. We know that the central incisor initiates at about 5 months and it completes at about 5 years, isn't it? We have seen that the initiation is approximately 3 to 4 months for incisors, right? And the completion is at 4 to 5 years. So instead of writing 3 to 4 months at initiation and 4 to 5 years at completion, what we can do is, let's say this is the tooth, and let's say that it initiated at 6 months and it completed at 5 years. So the total duration for which the tooth was forming is approximately 4.5 years, right? So what is the benefit of having this 4.5 years is that we can divide this tooth into 3 equal parts, right? We can divide this tooth into 3 equal parts. So like this we can divide it into 3 equal parts, and each part would represent 1.5 years in the development, isn't it? 1.5 years. 1.5 years. So 1.5 plus 1.5 plus 1.5 is 4.5 years, right? So that way it becomes easier to calculate. So let's say this tooth completed in 3 different segments, 1.5 years of each, right? And it initiated at 6 months, it completed at 5 years of age. And as we know, where does the initiation begin? At the incisal edge or at the gingival margin? The markings that I have done, 6 months at the cervical margin, 5 years at the incisal edge. Is it correct or is it wrong? Is it correct or is it wrong? Where does the tooth initiate? I think we have discussed this while we were studying about the ambulogenesis, isn't it? While we were talking about the ambulogenesis, I told you that the tooth initiates or its calcification begins at the cusp if it's a posterior tooth, and at the incisal edge if it's an inferior tooth. So what do you think? The markings, these markings 6 months and 5 years done by me, are they correct or are they incorrect? Should I switch them or should I keep them as they are? तो तुम में से किसी ने कुछ टोका नहीं, या तो सब सो गए हैं या सब भाग गए हैं, right? They need to be switched, isn't it? They need to be switched. किसी ने भी ऑब्जेक्ट नहीं किया कि सर ये गलत लिखा हुआ है. ठीक है, तो 4.5 years में टूथ कंप्लीट हो गया. 1.5 years के अंदर इसमें 3 सेक्शंस कर लिए. Right now, let's say the defect is somewhere around here. Let's say the defect is, as we have drawn in the last picture, let's say it is somewhere here. Like it is somewhere here. So at what age do you think this defect has occurred? At the incisal age, the age was 6 months when the tooth initiated. The completion of incisal third took 1.5 years. So at this time, the patient was about 2 years of age, isn't it? So we can say that the defect occurred about 6 months to 2 years of age, when the patient was 6 months to 2 years of age. If you want to further predict the age accurately, what you can do is this 1.5, it can further be divided into another 3 sections of 6 months, right? 6 months, 6 months, 6 months, or half year, half year, half year, isn't it? So we can again predict that this defect, let's say in the first 6 months, here the patient was about 1 year of age, and here about 1.5 years of age. So we can safely predict that the patient was approximately 1.5 to 2 years of age when this defect was formed, when the patient was exposed to a certain drug or fluoride or any disease, isn't it? So same thing when you apply here. Let's say we divide it into 3 equal parts. So you can see that here this defect is running almost at the junction of the cervical third portion of the incisal third, isn't it? If we divide this cervical segment, if we divide this incisal segment into 3 parts, this defect is almost at the junction of lower and middle third, isn't it? So the age is somewhere around 1.5 to 2 years. Is it clear? So that's how you can calculate the age at the time of defect. क्या इसमें कोई डाउट है? क्या किसी को कोई डाउट है? क्या आप लोग कुछ पूछना चाहेंगे? So we can calculate the timing of effect. We can say whether a tooth is missing or not, right? Hypodontia है या नहीं? Let's say the patient is around 2 years of age, right? The patient is around 2 years of age and no primary, no canines, let's say no canines have yet erupted. So what would you say? The patient is hypodontia, or the tooth has been delayed, or how would you say that the tooth has been delayed, or the tooth is absent, or it is normal to not have canines at the age of 2 years? What would you say? क्या कहेंगे हम लोग कि ये सही है या नहीं है? So the canines, they erupt at an age of about 19 months, isn't it? We remember from the chronology table that they erupt at an age of around 19 months. That is approximately 1.5 years. The patient is already 2 years, so we can say that a delay of 6 months is normal, right? So what is the normal delay in the eruption? Approximately 6 months for primary and approximately 1 year for permanent. That is considered a normal delay, right? That is considered a normal delay in eruption. So we can say this is a normal eruption. Now if you want to know whether this is hypodontia or a delayed eruption, you can take a radiograph. So if the tooth is absent in radiograph, then this is definitely hypodontia, and if it is present, then it is nothing but a delayed eruption. Clear? That's how you can calculate the age. You can predict whether the tooth is delayed or whether it is absent. You can calculate the timing of a defect formation. Isn't it? That's the application, or the clinical application of this chronology. Is there anything that you would like to ask? कुछ पूछना चाहोगे? Do you have any confusions, or is it clear? क्या किसी को कोई डाउट है? कोई पोर्शन छूट गया हो, कुछ समझ में नहीं आया हो, यू कैन आस्क मी। चलो, अगर नहीं कुछ पूछना है तो गुड नाइट, और हम दोबारा मिलेंगे जल्दी, राइट?